Hello everyone. I am Dr. Berkkkaratas. We have explained medicine therapy and shockwave therapy in erectile dysfunction. Now, we will continue with the treatment of the penis, PRP, or its trade name is P-shot. PRP treatment is widely used in the world. It is used by many departments on hair, face and joints. Its application to the penis has a 4 to 5 year excuse like shockwave therapy. It is very often practiced, especially in the United States and Northern European countries. The basic logic of PRP treatment consists of taking the clotting cells in our blood, artificially activating them outside, in the external environment, and then giving them back to our body. Normally, clotting cells are inactive as they circulate in our blood. However, when there is a wound or a cut, it goes to that area very quickly. Its first task is to stop bleeding. Its second task is to ensure the healing of that area by secreting growth factors, especially vascular growth factors, after stopping the bleeding. In our normal blood, as I said, in our normal blood, these are not active. We take them in a step-by-step way, activate them and transfer them to the penis. In primary care, we take a blood. The process of taking blood is very simple. When you go to the normal laboratory, we take blood in the same way as you take blood. We take 2 tubes. Approximately 10 cc of blood is taken into each tube, that is, 20 cc of blood in total. After this blood is drawn, we have a device called a centrifuge. This is being put on the device. Inside this device, these 2 tubes rotate rapidly between 1500 and 3000 revolutions per minute, between 6 and 10 minutes. The reason we do this is that, normally, there are not only platelets in this blood, there are a lot of cells. We do this centrifugation process to obtain platelets, to separate them. In the first layer, that is, in the upper layer, there is a serum layer that is 90% water in the upper layer of the tube. In this, proteins, elements, vitamins are all here. Underneath this is a red layer. In that red layer are our blood cells, which we know. Here are not the 2 places that are targets for us. Very little in the middle, that is, in this 10 cc we will get 0.1 or 0.2 cc of thin white layer. There are coagulation cells in that white layer. In the third stage, we pull these coagulation cells from here with the help of a needle, with the help of an injector. In the fourth stage, we put some activating substances into this liquid. In the fifth stage, we inject it into the penis. We do not inject under the skin of the penis. We have already mentioned too that we call the hardening part of the penis. We inject into those structures from the right and from the left. We do not anesthetize during the procedure because it is like a simple hip injection. The idea of injecting the penis may make everyone a little hesitant, but we have not had a patient who could not stand it or was very uncomfortable so far. We just apply a numbing cream to the skin area so that you don't feel the first bite of the needle. This procedure takes an average of half an hour. In other words, our patient's PRP application time is approximately 30 minutes. After the procedure is over, we can easily get up and return to our normal lives. Are there any side effects of the procedure? To date, there are no side effects detected in the world. Do we apply PRP treatment to every patient? No, it is not recommended. Technically, PRP treatment is not recommended to be used alone in erectile dysfunction. The scientific and clinical data for the cause are still very new. There isn't a lot of supporting information on those. So what do we do? In addition to shockwave therapy, we provide PRP treatment in patients with moderate and high erectile dysfunction, especially serious diseases such as diabetes, cardiovascular disease or muscle diseases, as in the USA. How many sessions do we give? Usually, at the beginning of shock wave therapy, we do PRP once when we first start. When the shock wave treatment is over, that is, after 3 weeks, we do another PRP. After that, we do PRP 3 times in total, to make another PRP a month later. In our next treatment, we will continue with needle therapy, which is the second-line treatment for erectile dysfunction. Thank you.